Hi, welcome to Silicon Valley Health Institute. We are a nonprofit organization. We have top world speakers coming and speak. Currently, we're having them every week. And all of these are posted on our website, www.SVHI, like Silicon Valley Health Institute. You can go there to join our email list, and you can also become a member, as we're a nonprofit, and that's very helpful. Well, today we're going to learn all about breast cancer and how to bust it. We have Susan Wadia-Ells, who's a PhD and a longtime cultural change agent. During the 1970s, she organized women at Polaroid, creating the first affirmative action program for women within a Fortune 200 corporation, and soon became Polaroid's corporate affirmative action manager and a mentor to other women's groups fighting for equal pay, training, benefits, and career opportunities. After returning to academia in the early 1980s for a graduate degree in energy economics and political development at the Fletcher School, she worked with a community development group in Zimbabwe as the nation's long struggle against apartheid ended. Next, she operated as a small town journalist in Brattleboro, Vermont, under the guidance of the legendary UPI international editor, Norman Runyon. She then moved on to complete her PhD in women's studies before teaching over the next decade in the Lesley University Adult Baccalaureate program in Boston. She's helped women to learn fearlessly to write their unspoken ideas and life stories. During this time, while raising her son, she also created a national feminist conference on the once ignored or banned topic, including the landmark Women's Way of Knowing study, exploring the personal growth dimensions within motherhood, understanding the power of women's menopausal years. Her 1995 anthology, The Adoption Reader, Birth Mothers, Adoptive Mothers, and Adoptive Daughters Tell Their Stories. This is in the Seal Press, Seattle. She helped define adoption as primarily a women's issue. In her column, Honest Health, published by the Gloucester Daily Times, beginning in 2008, her longtime Busting Breast Cancer blog, and a 2013 email, Birth Control Drugs and Breast Cancer, Learn the Terrible Truth, all served to introduce many of the topics discussed in her 2019 book, Busting Breast Cancer, 5 Simple Steps to Keep Breast Cancer Out of Your Body, based on the new metabolic theory of cancer. She currently lives in Manchester by the Sea in Massachusetts. Welcome. We're very honored and glad to have you here.
Well, Susan, thank you so much. And what an honor it is to have been invited by the Silicon Valley Health Institute. I want to thank Bill Grant, who's I see in the bottom right corner of the screen here, one of your members, and also an amazing longtime supporter and mentor of me. Chapter 3, which in the book covers a lot about vitamin D3, specifically as it pertains to breast cancer. Bill has been my superb mentor in all of this. And he, of course, is, as you well know, a world-renowned expert on the benefits of vitamin D3. So I've been incredibly lucky. Also, as many who know about the book know that Dr. Thomas Seyfried, who is the author of, he's the eminent geneticist at Boston College, and he wrote the landmark book describing for the first time the complete metabolic theory of cancer, which I believe he should, I hope he will win the Nobel Prize within the coming few years. He deserves it because he has finally been able to put together decades of research on the actual biological origin and progression of cancer. So we now know how to resolve the disease. And because of his work, I was able to put together epidemiological statistical studies that people have been doing for decades on, eat this, don't do this kind of exercise, don't do that. In order to prevent breast cancer. But no one in those statistical studies had ever understood why one woman develops breast cancer and another woman does not. And thanks to Dr. Seyfried's work and his book, I have right here, in fact, called Cancer as a Metabolic Disease. It's a textbook. I think it's probably $100 So it's not easily accessible to people. But hopefully, if like me, the layperson, one is interested in understanding this new metabolic theory of cancer, they can read chapter 1 in my book, which just went up on Amazon about 3 weeks ago. It's not even and so in it, I have, because I am not a scientist, I am strictly an investigative journalist, a nibby nose, you can call me, and an amazing generalist. I mean, I sort of never stay in one discipline, for better or for worse. So that I've been able to put together a book, I believe, that really almost anyone can understand, and then begin to understand, one, the biological origin of each cancer cell. And it turns out that cancer is not a complex, personalized, morass of many diseases, which the cancer industry today would love you to believe. In fact, cancer is a single logical metabolic disease that is caused by, as Tom says, it's the suffocation of the mitochondria. And he must have repeated that phrase to me and to many others thousands of times, because, and I think this is the most important piece of information for anyone watching or listening to my talk today to walk away with. And that is that all cancer is initially caused by people's lifestyles, by things that happen to us, things we do to ourselves, things that maybe even began before birth in utero, but things that are happening to our cells in our body, and they are suffocating those little tiny power batteries in our breast cells, in our colon cells, in our liver cells. And apparently, once those little power batteries, called the mitochondria, once they are suffocating, either, if they're supposed to die at that point, like all of our cells die eventually, or every few weeks, every few months, depending on the organ, and then new cells, healthy cells, grow. But with some cells, sometimes when the mitochondria suffocates, what apparently happens is those little guys, they used to be single cell bacteria in prehistoric time, before our bodies, our cells, everything had enough oxygen to respire or process oxygen. And so those little mitochondria, once we suffocate them, they're not able to respire or process oxygen anymore. And they remember back in prehistoric time that they used to be like a compost heap. They were little single cell bacteria gulping down all the glucose and mindlessly multiplying. So in fact, today, what a cancerous tumor is actually is like that compost heap. It is it's filled with mindlessly duplicating cells that are eating glucose. And what Tom has found, and why I believe Dr. Seifert has found, and why I believe he will be winning the Nobel Prize, or should be, is that he also understood that it isn't just glucose that those cancer cells are eating. It's something called glutamine. And those people with even a basic biology background know that glutamine is the most important and most prevalent amino acid in each of our bodies. And our cells, to stay healthy, our bodies to stay healthy, need glutamine. So what Tom and other metabolic biologists, oncologists are now trying to figure out is it's easy to stop the glucose going into someone. You just stop eating carbohydrates. That'll do it right away. But how do you block the glutamine that is feeding a person's cancer cells without harming the glutamine that our healthy cells need? And so that is what a foundation that everyone should know about. It's called the Foundation for Metabolic Cancer Therapies, and it's run by a man by the name of Travis Christofferson. And he set this foundation up strictly to help Tom Seifert at Boston College do his laboratory work to figure out how to figure out the best way to help people with stage 4 metastatic cancers, how to block the glutamine without harming their bodies. And this is critical information, because I don't think a lot of people realize that right now, in the past, during 2020, we lost more people from cancer than COVID. And we are continuing to lose more people every day from cancer than COVID. And if we would only have a concern as great as we have now for COVID, for cancer, people would understand that our cancer industry that's out there right now is not the best industry in the world. It is not, it does not understand that how each person's first cancer cell begins. And if you don't understand the origin of a disease, you have no business treating that disease. As Dr. Seifert very often will say, whenever you see a woman or a man who has lost all of their hair to the toxic therapies from cancer, you know that that person's physician does not understand the biology behind the disease they are treating. Because physicians are told the first thing is their motto, their creed is first do no harm. And today, every oncologist out there first does harm to a woman, to a man, when they begin to treat their cancer. So that's sort of a quick and dirty understanding of the metabolic theory of cancer. And again, for people who understand biology, physicians hopefully would understand this. They really need to read Tom's book, which is published by John Wiley and Sons, which is the most eminent publisher of science and engineering books. So it's a reputable publisher, so that the real research world understands that Dr. Seifert knows what he's talking about. The problem is getting medical schools to begin to teach the metabolic theory, because right now, if you look into it, much of their curriculum is being funded by the pharmaceutical companies. And once people start to choose metabolic therapies and walk away from the Dana-Farbers and walk away from the Sloan Ketterings and the Fred Hutchinsons and say, no, you don't have the right idea. We do not want to be harmed with your toxic therapies. We want to have metabolic therapies because they help us achieve optimal health, and they are effective at starving our cancer cells of the glucose and the glutamine, the only two fuels that are keeping those cancer cells alive. So that, again, is the theory. So, and what I'll do now, I think, if you'd like, is to talk about my book, Busting Breast Cancer, the 5 Simple Steps to Keep Breast Cancer Out of Your Body. And first of all, everyone wants to know, well, what are the 5 simple steps? What are the 5 simple steps? So let me quickly go down them, and then we'll circle back around and deal with each. And once we start dealing with each of the 5 simple steps, I would invite people, if they want to talk about that particular step, to ask questions, if that works with Stephen and Susan, the way you have this meeting formatted. So the 5 simple steps are the first, and it's the one that a lot of women don't like at all. It has to do with the fact that over 75% of American women right now are overweight or obese. And those excess fat cells in our bodies, if we are one of those people who is overweight or obese, those excess fat cells are 24/7 producing this type of estrogen that basically serves to make sure that overweight woman's body that her hormones are not balanced. She's ending up with much more estrogen than progesterone. And the issue is not that estrogen per se is bad or progesterone per se is bad. Those are our natural hormones. They keep us juiced up. They keep our hair good. They keep our skin good. They keep a libido going. And that's what we need. But when you're overweight, you're producing much more estrogen, especially as you get older, because we're not producing as much progesterone and estrogen as we did when we were younger. So if we're overweight and we're postmenopausal, we are just asking for havoc in our bodies. And the happy news, because it's never fun to lose weight. But the happy news is that there is a decent way to lose weight now that goes against everything women and men have been taught. And that is cut out the carbs, except for the leafy greens and a tomato once in a while and an eggplant once in a while. Cut out the carbs, no grains, forget your oatmeal, no fruit, forget your banana and oatmeal in the morning. It's the worst thing you can have for yourself. And go with good fats, natural fats, moderate amount of protein, and a lot of leafy greens and other non-root vegetables. Because root vegetables, carrots, beets, they are filled with they're filled with sugar. I mean, they're the storehouse for the plant. So once you get into eating that way, it is amazing, especially once you're able to cut back a bit on the fat, your body starts to process your own fat. And I know I lost 20 pounds. I never was super heavy, but I was like a BMI of 25. I was like 140. And, you know, at once I hit postmenopausal. And I just started eating like this. And then I'm a good cook and I love to bake and I love to cook. I discovered almond flour, and that's not carbs. That's fat and protein. You can make cookies, you can make whatever you want with almond flour. And so you don't have to deprive yourself. You just can't do takeout every day and think you're going to lose weight, because takeout, unless you're, you know, it has lousy fat usually and a lot of carbs. But I think the other thing women need to understand about losing body fat, I should say that the reason you want to get rid of the body fat is whenever you have unbalanced estrogen, more estrogen than progesterone, that attacks the mitochondria. That helps suffocate the mitochondria. And estrogen and progesterone, they can't enter all of our cells, but they can certainly enter our breast cells, our ovary, the cells in our ovaries. In men, they can enter the prostate, which is why we have so much more prostate cancer in men than other types of cancer. And breast cancer now leads cancers in women more than lung cancer. And again, the question is, well, why are so many women so overweight? And it turns out that we have been duped. The American public has been duped for decades by this thing called the food pyramid. And the food pyramid is put out by the FDA and you know, Department of Agriculture. And it's like, well, where did this food pyramid come from? Because for the last 4 decades, it says eat 7 servings of carbohydrates, grains and breads and cereals, and sparingly eat natural fats sparingly. Well, that pyramid needs to be flipped upside down. Be eating a lot of fat, some protein, and eat the carbs sparingly. And the question is, why does the government keep repeating itself and keep publishing this food pyramid that is upside down, that is causing all of this sickness? All of 75% of women today are overweight or obese. Why is this? And I'll tell you, this was the most boring piece of my research, but I spent about, I don't know, 2 weeks maybe trying to unpeel this onion. Who is creating this food pyramid? Who is really in charge? And what you'll find in chapter 2 in my book on Amazon today is that it is something called the American Academy of Medicine. It used to be called the the National Academy of Medicine. Used to be called the National Academy. Today it's called the National Academy of Medicine. Used to be called the National Institute of Medicine. It's the same animal. And it is nothing but the best funded lobby group for the processed food industry, for the chemical industry, for the medical industry. And it turns out that Congress back in 1990, maybe, you know, they passed a nutrition law, and it says you know, before you publish any of these dietary guidelines for Americans, which is the food pyramid, you should seek the expert guidance of groups such as the National Institute of Medicine, or or this or this. And so the Congress, and I guess it's because they get so much money, most of the senators and congressmen still today get so much money from the cancer industry, the medical industry, the processed food industry, the chemical industry, that they are willing to let this huge lobby group control our food pyramid. And there's something called the National Nutrition Coalition, and they have been doing their damnedest. They're a group of amazing functional medicine people. They've been doing their damnedest to try and change the food pyramid so it has many fewer carbs and much more fat. But they keep getting flummoxed because all of a sudden, when the new, even though they give all the expert opinions, when the new pyramid comes out, it's the same as it ever was. And what no one has seemed to realize is it's this National Academy of Medicine that is the culprit. So again, hopefully chapter 2 in my book describes this whole fiasco that I just described in terms of step number 1, which is women need to lose their excess body fat to balance their estrogen and their progesterone, and to also be able to stop feeding their bodies with glucose and to start feeding their bodies with something called ketones. And ketones are made by our liver. And of course, the new rage is the ketogenic diet. A lot of athletes are really enjoying it because it really can give you optimal health. So again, one way to prevent breast cancer is to lose your excess body weight, flip to a ketogenic lifestyle, the high fat, the low carb, and not only give yourself good athletic performance, good brain performance, but stop breast cancer from beginning in your body. So that's step number 1. Step number 2, and I'll run through the other 4 quickly, and then we'll circle back like I promised. Step number 2 is get your vitamin D3 blood level above 60. And this is the same for COVID. Everything I say about protecting yourself with high D3 blood levels to protect against breast cancer will also protect you against COVID. And again, for some reason, our government doesn't want to tell women to do this as a prevention mechanism for breast cancer. And boy, are they trying to enforce never telling the American public anything about D3 as prevention for COVID. And I don't even want to begin to talk about, because I have no idea why they don't want Americans to prevent COVID using high vitamin D3 blood levels. Do they want to help the pharmaceutical companies sell more vaccines? I don't know. It's not my topic. It's not my subject. But breast cancer prevention is my subject. And I'm here to tell every woman she needs to do year-round indoor and outdoor tanning unless she lives in the Florida Keys. Because, and if she does, she needs to get herself out there in the sun for 10 minutes every day with a bikini on, and not to use sunblock, and to develop an incredible tan in order to develop the best kind of D3, the most powerful that you can. And Bill Grant, who's with us today, there's supplements. He's shaking his head. Maybe he's disagreeing with me, but he can come in a minute and tell us where I'm wrong here. But my understanding from reading many of Bill's works and others is that the combination of taking D3 supplements with K2 and with 1,000 milligrams of calcium is a wonderful way to get your vitamin D3 up there. But I find as you get older, as I have seemed to do over the years, that I can keep it above 60, above 70, much better if I'm doing 5 or 10,000 IUs of D3 the days I'm not doing indoor or outdoor tanning. And that I really need that tanning to help keep my blood levels up there. So that's number two. The third one is to basically stay away from all progestin drugs, PROGESTIN, and this is chapter 4 in my book. And progestin drugs are found in every birth control drug out there on the market. They're also found in 99% of the IUDs. They're now lacing them with progestin. There's only one hormone-free IUD allowed on the US market, and that's another government-enforced fiasco to support the sale of birth control drugs in the United States. And the progestin drugs are also in what they call combination menopausal relief drugs called Prempro, and there are about 4 other brands now. And women who are my age, you know, above 65, will remember that in 2002, we heard from the Women's Health Initiative, the National Health Initiative, that said, oh, guess what? 26% women who have been taking this progestin and estrogen combination menopausal drug in this huge study of like 9,000 women, within 3 years, they had 26% more palpable breast cancerous tumors in their than women who were not taking the progestin drug. And so they quickly they aborted that trial halfway through its life. And more than half of the women, and there were, I think, 12 million women on this drug, they stopped filling their prescriptions that very month. And the farm Wyeth went berserk, the drug company that was selling Prempro at that point, and they basically lost a huge amount of money, and they've never forgotten it. So instead of going ahead and doing a similar study on women taking birth control drugs, which would have shown us that those women are getting more than 20%, 26% more breast tumors within 3 or 4 years of taking the birth control drugs, they basically never have done that study. And in 2010, a very, very important piece of research came out. And again, it's all in chapter 4 in Busting Breast Cancer. And there was a panel that discovered that the exact biological mechanism of how the progestin goes into the cell and creates another, creates a protein that basically, it would appear, is suffocating the mitochondria. So this study that was in Nature magazine, and it's cited in my book, basically it showed biologically how the progestin in birth control drugs and in some menopausal drugs, how that progestin not only can initiate breast cancer in a woman, but can accelerate any existing, even dormant cancerous tumors in her breast. And so it's incredibly important that American women work to be able to have many, many different hormone-free IUDs allowed on the US market. Right now, it's one size fits all. A lot of women are not doing well on that thing called Paragard because women's uteruses are different shapes and different sizes, like everything else about human beings. We're all individual. And in Europe today, they have dozens of models and makes, sizes of hormone-free IUDs that are not allowed on the US market. And I won't get into the complex FDA regulations about that, but again, it's in chapter 3, and women have to, chapter 4, and women have to begin to demand that the FDA change a single administrative regulation that would allow the US market to be flooded with $30 hormone-free IUDs of all shapes and sizes. Right now, they've got a monopoly going. The US government has created a monopoly for one company, one IUD that is hormone-free, and they're charging $900 for a 50-cent copper coil IUD. It is a travesty. But my understanding is they've been doing this as a way to keep as many women on birth control drugs as possible because it gives them money every month when a woman fills that prescription. And of course, it has made premenopausal women in America have the highest breast cancer rates of any group of younger women or older women in many cases in the world. So right now we have about, I think, 70, I think the numbers are 70 women out of 100,000 premenopausal women can expect to develop breast cancer every year in the US. Whereas in Eastern European countries, it's like 45 women of all ages out of 100,000 women can expect to develop breast cancer. So we have such an unnecessary breast cancer epidemic in this world right now, caused by low vitamin D3, obesity, and pushing birth control drugs on our younger women. So those are three. Here comes four. The fourth is, and this is the most incendiary step, I basically am not in favor of mammograms. Mammograms do not prevent breast cancer. They only tell you, did you get it yet? So that, and women have, American women have been brainwashed into believing that mammograms is the way I'm going to protect myself from breast cancer. And nothing can be further from the truth. So what busting breast cancer, what I'm talking about here is teaching women again how to do regular self breast exams. That's now banned by Susan G. Komen. It's banned by the American Cancer Society. When I was in my 20s, 30s, even 40s, we had the shower cards that Planned Parenthood would give us, and they were plastic coated, and they were, rectangular. And we'd take them home when we went to the Planned Parenthood clinic, and we'd hang them on our shower, and it would remind us and sort of show us, how to do the breast exam. Those are verboten. Those are not allowed anymore. The Susan G. Komen says, if you want any money from us, $10,000 a year, $100,000 a year, if you mention breast self-exams, you don't get a nickel from us. And Susan G. Komen for the Cure is financed by the pharmaceutical companies. It was started by the pharmaceutical companies. Its lifeblood is the pharmaceutical companies, and they do not want women to do anything but have mammograms and use birth control drugs. And so even though I used to love my Planned Parenthood clinic, that was my OBGYN when I was premenopausal, I want to bring the bad news to people right now that Planned Parenthood is absolutely, in some cases at least, promoting birth control drugs. Their website, the one that I looked at, only tells you the benefits of taking birth control drugs, does not mention a downside. If they do, they say it doesn't last more than a few weeks. They don't ever mention breast cancer risks. And it's a very sad situation. So again, that's chapter 4 in my book. No, chapter 5. And also, in terms of if you're not going to do mammograms, which I recommend that women do not do mammograms, and I explain why and why it's dangerous. The other thing that's important is to have a clinical breast exam once a year. And again, the American Cancer Society has come out with guidelines saying clinical breast exams are not even recommended. They don't tell us why, but that's what they're saying. Do not let yourself and do not let any medical practitioner touch your breasts. Only allow a mammogram to smash your breasts and radiate it. And what I come up with again, and here comes my political economy background screaming to the forefront, is that mammograms today, I can't believe these numbers, but 40 to 60% of women who go to have a single mammogram and they're told, I'm sorry, Daisy May, but you have been diagnosed with stage 0 or stage 3 breast cancer, that 40 to 60% of those women do not have breast cancer that either exists at this point and may never exist, or they do not necessarily have a tumor that's growing. They call them indolent tumors. And there's an amazing researcher, an MD by the name of Gil Welsh. And he was at Dartmouth for a couple of decades. And he has done amazing statistical studies, international studies that show us that 40 to 60% of women who are diagnosed with stage 0, stage 1, stage 2, stage 3 breast cancer, basically, if you leave they called atypical cells, DCIS, stage 0 breast cancer, and then most of the stage 1 tumors, if you leave them alone and you watch and wait, that they will not develop into any problematic anything. And so that 40 to 60% of women diagnosed with a breast cancer by the industry today because of their mammogram is being overdiagnosed and then overtreated. They shouldn't have been treated. They should watch and wait. And in the case of stage 0 breast cancer, all that means is you have inflamed, strange looking cells, but they're not cancerous. Those women, they should be using the 5 simple steps. Lose your excess body fat immediately and get your vitamin D3 up there, because that will get your immune system to block any abnormal cells that start to suffocate. And also to, of course, get off of your progestin drugs. So that's the 4th. And the 5th is one that I think most of us know. We want to keep our bodies detoxified of junk, of chemicals, of chemical estrogens called xenoestrogens that are in pesticides and non-organic food, that are in flame retardants, that are in personal care products that you buy at CVS and Walgreens. I mean, it's virtually impossible unless you maybe grab, what's it called? Not Bumblebee, Busy Bee. There's some kind of, the CVS does sell them, sort of chemical-free cosmetics, but 98% of all of the cosmetics you find at these, corporate chain drugstores are filled with these xenohormones that basically, again, attack the mitochondria. Everything we're talking about, the progestin attacks the mitochondria, the excess body fat, the estrogen from the excess body fat suffocates the mitochondria, the chemicals in all of these, the air, the water, the personal care products, cleaning products suffocate the mitochondria. And as we know from Tom Seyfried's work in cancer as a metabolic disease, the first cancer cell in every person's body begins once you suffocate the mitochondria in your colon, in your breast, in your prostate, in your brain. And so it's really wonderful. We now understand why one woman develops breast cancer while another woman never does. And we never understood that before. In fact, women who have been diagnosed with breast cancer tell me, do you know what my oncologist told me when I said, how come me, doctor? He said, or she said, well, maybe Daisy May, maybe it was, you were just the unlucky one. Or they'll tell the women, well, I guess, Sarah, it was just your turn. Or they might say, oh, Mary Lou, I guess it's in your family. Those are the only 3 reasons those doctors can come up with today if they still believe that cancer is a genetic-based disease. But of course, what the cancer industries believe is, we're not really sure why you got it, but for some reason, maybe chemicals, we don't know how, but for some reason, one of the cells in your breast, it had a funny mutation, and that mutation, turned it, into this mindlessly duplicating cancer cell. But don't worry, we don't really understand how you got it, but we'll take care of you. And of course, 1,600 to maybe 2,000 people a day in the United States are dying of some kind of cancer, more than are dying of COVID. And so it's because I said, I realized that it was like they were saying 500,000 people well, I'm lousy on my numbers, but if you get 2,000 people a day dying of all cancers times 365, you get more people dying of cancer in 2020 than you have of people dying of COVID. So I think we need to be as concerned about cancer and how we deal with it as we are concerned about COVID. And until that happens, the cancer industry will continue to make billions of dollars. It will be good for employment for those in the industry, but not good for people who are being diagnosed, in this case with breast cancer and for all cancers. So those are the 5 simple steps. And I guess if anyone has any questions, I'm happy to discuss them, try my best to answer them. And so I'll let that happen. Bill, do you want to talk about when you were shaking your head about the vitamin D3, and I was talking about indoor outdoor tanning, and how I understood that you know, your book that you did 2 years ago on enjoying the sun, the benefits of the sun.
We have a question about thermography as a possible alternative to mammography.
Yes, good. I'd love to talk about that, but let's hear from Bill first and what he has to say about the D3, how best to keep it up high. Oh, he needs to be unmuted, Stephen.
There we go.
Okay, thanks. Well, yes, it's important to get vitamin D level up to around 50 or 60 nanograms per milliliter. Grassrootshealth.net showed that in a community and clinical trial analysis of data of women who got anywhere from less than 10 nanograms up to 60 or 70 nanograms per milliliter. And there was still a downward incidence for breast cancer at 60 or 70 nanograms per milliliter. But there's no difference between vitamin D3 that you make in the sun and vitamin D3 you take orally. It's also, if you go in the sun can both create and destroy vitamin D.
Oh.
It destroys some of the metabolites of vitamin D, and that sort of pulls away from vitamin D at all. And I think that's nature's way of trying to adjust the vitamin D level, not too high, not too low. The problem with when you get it from the sun is, first of all, you cannot make vitamin D in the sun half of the year if you're above 35 or 40 degrees north latitude. That was shown in Boston and in Massachusetts. Just 6 months a year, you cannot make any vitamin D. You're just going to freeze in the sun out of doors. So and we live indoors so much now in terms of occupation and so on, that people are just not out of doors enough to make much vitamin D. Now, when I started my work on vitamin D and cancer, if you go to my website, sunarc.org, sunarc.org, you'll see the maps of like breast cancer mortality rate around the country. And in the Northeast were the very high rates, in the Southwest were the very low rates. Although in California, the Bay Area had higher rates too. And that was in the 50s, 60s, 70s, and 80s, when we were not afraid of the sun. We were not using suntan lotion. We were working out of doors more. We had people on farms, more, et cetera, et cetera. And you had this quite a bit of variation by a factor of 2 between high and low areas. But now, because people are more obese, treatment has increased. You have other factors that you mentioned that have crept up. You can no longer see this geographic variation of breast cancer and other cancers in the United States, at least not as much as it used to be. But so that's now as to why the cancer industry does not like vitamin D, it's the entire medical system does not like vitamin D. I've published at Orthomolecular Medicine News Service my interpretation of the disinformation playbook as applied by Big Pharma for vitamin D. They're using the same playbook that the tobacco industry used, the sugar industry used, the National Football League used in terms of concussion and so on. what they're trying to do is, for example, in vitamin D, they published hit pieces on Michael Hollick in the New York Times saying, you know, he's the best vitamin D person. Well, he takes money from the tanning industry. He takes money from the Quest. He's corrupt. Well, big pharma people take money from big pharma. Are they not corrupt? Of course they are. And then they do poor studies. For example, most of the randomized controlled trials of vitamin D were based on the guidelines for drugs. And for drug trials, you assume that the only source of the agent is in the trial, and there's a linear dose-response relationship. Well, you got sun, you've got diet, you got supplements. So you're just not, you can't, unless you base your clinical trials on vitamin D levels, not on doses, you're not going to get the right answer. Because
right. Bill, can I mention something too about obesity and vitamin D3? Because I found this very interesting in my research, is that individuals, women and men who have excess body fat, those excess fat cells become their largest endocrine organ in their body. And they're obviously very active, and that they are absorbing a lot of the D3 that an overweight, obese person receives either from supplements or from the sun. And that D3 is not able to help power up the immune system, which is what we're hoping to do when we're looking at breast cancer or any cancer. But in fact, it stays stored in their fat cells. Now, it does have a good effect on the fat cells. Apparently, it keeps the fat cells from being super inflamed. So it has, you know, a minor impact, but it basically, you know, so if someone is overweight or obese, they want to raise their D3 levels to, as Bill is saying, a specific level, be that 60, 70, or 80 nanograms per milliliter. They should be taking, instead of 5,000, they should be taking 10,000 a day. Instead of 10,000, 15,000, because X% of it is not going to help their immune system. It's just getting stored. And then what one functional medicine physician found when he had many of his patients on the ketogenic diet and they started to lose weight, once they lost like 15% of their body weight, their D3, their fat cells let loose with the D3, and all of a sudden they went from like 40 nanograms per milliliter up to 60 or 70 nanograms per milliliter. So that, you know, they benefited finally from the D3 they had been storing. So maybe let's take some other questions. I see lots of questions flashing at me here on the screen. The first one that came up, I think, Stephen, you mentioned, was someone was saying, what about thermography? And I'm really glad that question has been asked. And thermography, you know, again, the cancer industry, breast cancer industry would like thermography to go away. They don't like thermography because, you know, what if women think it's useful and what, you know, and it takes away the spotlight from mammograms. Well, the important thing about thermography is it's not necessarily going to identify slow growing tumors. Thermography is only looking at the heat that is emanating out of your breasts. If you're doing breast thermography, I have had whole body thermography, which I personally prefer. And it's called regulation thermography. And there are not a lot of regulation thermography practitioners around. There's a single company that is manufacturing that, Dr. Dan Balin. And he's a really interesting human being who is really dedicated to promoting the proliferation of the use of regulation thermography worldwide. And basically what that does is a sensor goes over all different parts of your body, and then a computer readout comes out and it shows where you've got hot spots in your body, where you have high levels of inflammation. And so it can, oh, I lost everybody. Let's see. There we go. Sorry. And so it can tell you if you have inflamed breast tissue, and again, if you find with an annual thermogram that you have inflamed breast tissue, that is a warning. Start doing the 5 simple steps, because all of those steps is going to lower your your tissue inflammation. And as we know, inflammation is the first stage of the suffocation of the mitochondria, which is the first step in the creation of that first cancer cell. So thermography is an amazingly wonderful screening mechanism for women to tell them how is your breast tissue doing. You know, should you get serious about lowering your inflammation? It's not going to tell you, oh, you got breast cancer or you don't. It's not set up to do that. It's set up to help you, give you a warning that you better get cracking. That whether and you know, when I say breast cancer is an unnecessary disease, so many people, so many women get really angry at me, and rightly they should, because no one has ever said that to us before. No one has ever said we can prevent breast cancer, because again, the cancer industry today doesn't know what to tell us when they say how to prevent breast cancer. They're guessing. But once we understand the metabolic theory, we then understand that inflammation is that first step towards suffocating of the breast cells' mitochondria. And that tells us, get working to lower your inflammation. The second thing is that ultrasound has now taken over. Whole breast ultrasound is taking over, or should be taking over, mammograms, because whole breast sonograms, ultrasound, can show if you have a tumor, and if that tumor is a cancerous tumor, if that tumor is a water-filled cyst, or if that tumor is not really a tumor, but has no vascularity, doesn't have any blood vessels going into it, and is strictly scar tissue. And there's a small company called Sonosine, and they take 1,000 ultrasound images of your breast. Underneath your breast, apparently tissue goes into your lymph gland, so it even looks at that. And of course, General Electric has come out with theirs, trying to knock Sonosine out of business. And then, of course, I'm sure GE may then make their Sonosine brand go away, so that women are left only with their mammograms. But there are other ways that women can screen and then diagnose any tumors that they may find, any lumps, without having to subject themselves to mammograms. So, and there were other questions here, Stephen. Have you been keeping track, or Susan?
We have one by admin, but I've been asking for him to unmute, and I'm not getting any response.
Is that the one about prostate cancer?
I have no idea. That's a raised hand.
Oh, I can unmute now. It took me a while to figure out the raised hand, since there wasn't actually a blue hand there. Okay. Thank you. So yes, I had 2 questions. One was if you had any suggestions for a patient who has metastasized prostate cancer, just came out of the hospital doing total radiation therapy. I'm just curious if you have anything specific, because it's prostate and because that person just went through radiation therapy.
Right.
My second question, I'll wait.
Okay. Well, I want to start off by saying that my research has not been in the treatment. However, it's really been in the prevention. But I have been connected with a few friends who are dealing with either metastatic prostate cancer or metastatic breast cancer. And we have found that there's a group called Care Oncology, and they are working with all stages of cancer patients, offering them, in addition to the radiation chemo, instead of the radiation chemo. They don't tell you what you should do in terms of radiation and chemo. They say, do what you want to do, but you can add our cocktail of metabolic drugs to your mix. And their cocktail is trying to lower your glucose levels in your body. And also they are using an anti-parasitic drug that will, once your glucose levels are really nice and low, then you take the anti-parasitic, and it's called a glutamine antigen. So it goes after the weakened, you're just taking enough so that your weakened cells are deprived, you know, it's able to zap, as I understand it, the weakened cancer cells of their glutamine fuel, but it does not harm the glutamine that is necessary and required and happening in your healthy cells. So it's called careoncology.com. It is not horrifically expensive. I think, especially compared to the chemotherapies and the immunotherapies that they shove on women these days with the metastatic breast cancer, which is in some cases like $30,000 a month or 130. I mean, the numbers, the costs of these things are unbelievable. And what Dr. Seifert finds is people who don't have good insurance and have metastatic cancer have a better chance of surviving longer and happily because they're willing to do, they can only afford to do metabolic therapies, and they can't do the expensive stuff, which is going to really harm them and let them die eventually. So right now, in fact, there are some individuals, some young guys in England who have Facebook pages. Pablo Kelly is one, and Anthony Scarborough is another. And they have both had glioblastomas, the fastest growing brain tumor. One of them has been going, they call it being out. You've had the diagnosis now for 5, 6, 7 years. One guy just had, he's just had another baby. They're living normal lives, but they're staying very, very ketogenic. And whether or not they're taking, I don't know any specifics about them, but they have their own Facebook pages. They do periodic videos, and they stay in touch with Dr. Seifert. And there we are. They're using only metabolic therapies. And, most time glioblastoma is the same kind of brain cancer that Teddy Kennedy had, Senator Kennedy had, and the same kind that Senator McCain had. And they are told, like everybody else who doesn't have any power or money, 11 months is what you can expect. They both died within 11 months. So if you go to the traditional cancer centers today with glioblastoma, it doesn't matter how powerful you are. You can be the King of England, the Queen of England, whatever. If you got glioblastoma, you're going to the Sloan Ketterings, the Dana-Farbers. The apparent situation is you don't last more than 11 months. If you are more like Pablo Kelly and Anthony Scarborough, and you say, you know what, I'm not going to have any radiation, I'm not going to have chemotherapy, and neither of them have had any of that. They've just gone ketogenic lifestyle, knocked out their glucose, and I don't know how they're doing with the glutamine, if they're dealing with the glutamine antigens or not. I don't know that. But they are continuing to live nice lives. So that's wonderful news for all of us. Okay,
hi,
names
Susan.
of these two, I'm seeing from Michelle to everyone, names of these two men, the two with the glioblastoma, Michelle, is that the two, Anthony Scarborough, Scarboroughgh, Scarborough Fair, Anthony Scarborough, and Pablo Kelly, Kelly. Tom Seifert, in fact, he said he's citing their Facebook pages in some of his more recent studies on how to deal with metastatic cancers. He said he had never cited a Facebook page before, but when it comes to these two guys, he's citing their Facebook pages because that's the research. And of course, the sad thing that everyone should understand right now is that the cancer industry will not allow metabolic oncologists or metabolic researchers like Dr. Seifert to do clinical studies of just taking 10 Pablo Kellys who haven't done any chemo, haven't done any radiation, or doing strictly the metabolic, and compare their outcome with the Teddy Kennedys and the Senator McCain's who were doing the Dana-Farber, the chemotherapy, the radiation, and show for everyone to see the difference in the results of these two types of therapies. Those studies are totally not allowed. The only ones that have been allowed thus far are once you radiate and give metastatic cancer patients chemotherapy and they're half alive, you can then give them, you know, ketogenic diets or ketogenic therapies and glutamine antigens and see how they do. So then people say, well, if these metabolic therapies are so wonderful, how come we don't have the clinical studies? But the Commission on Cancer that runs the cancer industry in this country will not allow it, because it's just like they will not release the data that we have nationwide on the number of women who are developing recurrent metastatic breast cancer. And I should talk about this because, again, my book, Busting Breast Cancer, it's on Amazon and Barnes and Noble, etc. I should say the ebook for this, we had to pull down yesterday. It was not formatted correctly. And we're working on that. It'll be up again in about 10 days. But for those people who had ordered the ebook and found that the formatting was not decent, do not worry. Amazon, Barnes and Noble, they've promised us that they will be replacing your faulty file with a good one. It'll probably take a couple of weeks, but you will get a good ebook file. So I apologize for that. This book, I should say, has been self-published. I didn't want even ask a publisher to consider it. I don't think they would have. I don't have a medical degree. I'm strictly an investigative journalist. I have depended on literally hundreds of raffle ticket sales and small grants from a few family foundations. Shirley Freeman is here. Her family foundation has been very supportive down in the Keys. I've been doing this project for 12 years. It's finally done. I still owe $40,000 and we are accepting tax deductible as well as non-tax deductible grants. My poor designer, she's been amazing, but I owe her money, and now I'll owe her more money as we reformat that ebook in an appropriate way. It takes money to sell books, and 20% of my net sales have been promised to the Foundation for Metabolic Cancer Therapies. And I have learned as a volunteer working on this project for the last 12 years, believe me, I have learned how to live very simply, and I'm fine. I'm happy doing it. So the other money that is gleaned from sales of the book is going to be used for my travel to go to conferences when we're allowed out to play again. And so I really urge people, if you like the work that I'm doing here with this book, we desperately need to raise this last $40,000. I have bills that I've got to pay as soon as possible. And I want to get out there and start to use some of the sale money, 20% to send to the foundation to work on more metabolic therapies for metastatic patients, as well as being able to keep the website going, keep my executive assistant. She's working now 5 hours a week at $15 an hour, bless her. I'd love to raise her pay to something decent. I'd love to increase her hours, but we really do need money, and we can do both tax deductible as well as straight grants. And I want to thank Bill Grant. Bill Grant has given me a lovely loan a few years ago. He understood. He self-published his own book. And so I need to pay Bill back as well. So it's this has been an independent study, and people have said, Susan, how could you have done this? And I say, easy. Nobody would pay me to do this. Anybody who's willing to do what I did could have done what I have done. I was in the right place at the right time with the right plan. And thank heavens, I've been getting a lot of grace around me and the right kind of support from people like Shirley Freeman and her foundation in the Florida Keys, Bill Grant and his wonderful loan to me a few years ago. And also with Tom Seifrid's support, that's why I'm on the Silicon Valley Health Institute's program today, because of Bill, as well as because Tom Seifrid is recommending that I talk to a variety of podcasts. So if you know of other podcasts and video interviews, I'm happy to do many of these. I think this is the way you sell the book, you get the information out to people, and my life is dedicated to this, and so it will continue to be.
Hi, Susan. It's Christine. I'll be donating, and I hope everyone will. A couple quick questions. What do you think of bioidentical hormone replacement under functional medicine practitioners, and what do you think about MRIs?
Okay. With bioidentical, I take them myself. So, I have to, you're looking for, and they have paraben free. I love Smoky Mountain Naturals. I think they call it SM. They've changed it. They made it more sophisticated, but you can still Google Smoky Mountain Naturals. They're not super expensive. You don't need to go to a compounding pharmacy. And you want estriol, E-S-T-R-I-O-L, not estradiol. You can go to CVS and get estradiol cream, for vaginal lubrication and things of that sort. You want estriol. You don't need estradiol. But for some reason, the pharmaceutical industry, they would love to shut down the production of this. Estriol is a much less potent natural estrogen. And if you take a little bit of that cream every few days and then a little bit of the natural progesterone cream every few days, you can also, before you start, you might want to take an estrogen balancing test. And Zava Labs, Z-A-V-A, David Zava is a researcher who helped write the Richard Lee books, Everything Your Doctor Won't Tell You About Breast Cancer, Everything Your Doctor Won't Tell You About Hormones. Those books have been out since 2002, I think, because Dr. Lee actually died in 2002. And David Zava and Virginia Hopkins and others have co-authored books since then. But Zava has a very good lab out in Washington or Oregon, and they'll send the test kits to your home. There's estrogen metabolite test that I talk about in chapter 6, I guess, and an estrogen balancing test. And both of those are good for a variety of reasons. If before you start to take bioidenticals. So that answers that one. And your other question was the MRIs. Was that MRIs? Is that true? Is that what it was?
Yes.
Okay. Naisha Winters, she has an amazing book out called The Metabolic Approach to Cancer. She is a functional medicine physician. She cured herself inadvertently of stage 4 ovarian cancer when she was 19 years old. And she said, thank God I was so sick, they didn't dare give me any chemo or I'd have died. I would have had total organ shutdown. And she was studying to be an MD, and there wasn't, she's probably maybe 50, maybe not, but they didn't have the internet when she was in college. So she's doing these, index cards. Anyway, she researched and she figured out enough to do mistletoe therapy and it's very interesting how she saved her own life. Anyway, she's now working with all sorts of medical doctors, functional medicine doctors around the world, and teaching them very, very practical approaches to dealing with cancer. So they can integrate as much of this metabolic theory as practices as they want to. And she recommends MRI for a woman who has had breast cancer and is wanting to keep checking to make sure she doesn't have a recurrence, especially if I would imagine if she's large breasted, so that she cannot necessarily feel like a breast self-exam or even a clinical exam is going to really tell her the whole story. She will recommend MRIs, but in a very selective way. I know Gil Welsh, who's now at Brigham and Women's, the physician who has done the best research on the dangers of mammography, or the unnecessariness or whatever of mammographies. He says, be aware of MRIs. It's not for everybody at all, but it is certainly for, as Dr. Nasha would say, for women who are worrying about a recurrence, and then MRIs play an important role, apparently. Any other questions?
Well, I wanted to make a comment about several women who were talking about being bullied and pestered about mammograms. I think that it's very useful to describe that to your doctor. Just shut them down and say, in my opinion, this is abusive, and please do not raise the issue of mammograms again, ever, with me. It's a good way to say it, that it's a form of abuse, so that if it happens again, you can say something to their administrator about the way that you're being treated.
Stephen, that's helpful, but there's a problem that we haven't talked about in terms of the whole mammogram industry. And that is, right now, they've got the insurance industry on their side. And we can talk about this whole big time nothing topic of dense breasts. I am so sick of hearing about dense breasts. And again, another boring piece of research I did. I think it took me 3 weeks to look at every piece of statistical research and biological research that's been funded on dense breasts. And let me tell you, there's been a lot of studies on dense breasts. But first, with the insurance thing we started to talk about. Right now, medical insurance companies and physicians are required to make a woman have a mammogram before she's allowed to have her insurance company cover an ultrasound. Even if she, quote, has dense breasts, which we know mammograms cannot read dense breast tissue. Everything looks white to them. But it doesn't matter. You still have to have a mammogram if you want to have an ultrasound if you have dense breasts. I mean, it is ridiculous. And I just got something in my email this morning, because I get these market research reports from the metastatic breast cancer drug, industry and the mammogram industry. And it's, I think Dr. Welsh says it's like the studies say it's like a $7 billion industry in the US, and it's growing by leaps and bounds, this mammogram industry. And that's one of the reasons that the insurance companies require before an MRI. I mean, I've just been working with a friend who has had to fight tooth and nail to not have another mammogram before she had her MRI, because she was sure or worried that she might have gone into metastatic. And she had to go to 5 different doctors to find somebody who would be willing to not force her to have another mammogram before she had that MRI. So women are really up against a lot. And in some cases, the physicians are up against as much as the women are up against, to try and fight the insurance companies about exempting women from mammograms. I know I had to sign a disclaimer with my nurse practitioner when I wanted to, I guess before I found out about Smoky Mountain natural, the bioidentical hormones, I needed to have a prescription from a compound pharmacist for this estriol and estriol cream. And And she made me sign something saying, I don't want a mammogram, I refuse a mammogram, before she was able or willing, both maybe, to write me a prescription for the estriol cream. So they are fighting. The physicians in many cases are fighting an industry, both the insurance industry and the mammogram industry, when they try and comply with a woman's desire not to have a mammogram. It's really, you know, it's a bitch, as they say out there. It's really nasty. Okay, on dense breasts. Let's talk about dense breasts, because God, that's headlines all over the place, dense breasts. I have not yet found a laboratory, a preclinical biological study that clearly explains what the biological connection is between dense breast tissue and the increased risk of developing breast cancer. And, you know, of course, once we understand the metabolic theory, we understand that that first breast cancer cell is caused by the suffocation of the mitochondria. The question is, how the heck is dense breast tissue connected to the suffocation of the mitochondria? There hasn't yet been a biologist who has found that connection. And I would guess there is no connection. But what we also know is that, I don't know, like 50% of premenopausal women have dense breasts. As you get older, you start to get larger breasts usually, and that's because you're putting fat. There's fat going into those breasts. So that older women have less dense breasts than younger women. But mammograms, no matter what, cannot read dense breasts most of the time. And so why do they keep pushing mammograms on us? And now we get back to the whole thing of Dr. Welch's research, which shows that 40 to 60% of women who were told that they have breast cancer based on that single or double mammogram are being diagnosed with stage 0 breast cancer, which used to be called ductal carcinoma in situ, which really should be called abnormal cells, because DCIS, ductal carcinoma in situ, has the word carcinoma in there. There is no tumor. There is no cancer cells, and the research is showing that maybe 5 to 6% of the time that a DCIS can begin to morph into a breast tumor, but that's usually because the woman is overweight, obese, or she has low vitamin D3, or she's filled with these chemical toxins, i.e. she's suffocating her mitochondria, which is why her breast tissue has these abnormal cells, because they're inflamed. And so again, dense breasts do not. There's no statistical study I have found there, and it's in the book. I list the studies that have something to do with dense breasts, you know, and meta studies. Chapter 5. Dense breasts are a non-issue that the mammogram industry and the cancer industry use to make women even more fearful about developing breast cancer.
One of the things that I've learned about vitamin D deficiency is that it promotes mismanagement of calcium resources, especially when it's combined with magnesium deficiencies and K2 deficiencies. And that's one of the reasons that tissues become inflexible and stressed, is because of soft tissue calcification, which is often a vitamin D, K2, magnesium problem.
Okay, I'm seeing someone saying she would like to purchase my book from my site, which I would very much appreciate. I'll talk about that. But she's saying she cannot, something about the website won't allow her to check out. Send me an email. I'll check with my web person today. That shouldn't be the problem. I'm Susan at bustingbreastcancer.com. SUSAN at bustingbreastcancer.com. And if you order the book from my website, you get a real nice bonus. which is, we've had about 1,200 copies printed up that I've been sending out to as review copies for sessions such as this to the hosts or to others who are have contributed, you know, scientific research to the book. But it has full color charts and graphs, which the like this, which you're not going to, and images, whereas the you know, and I think Jackie Ostrom is on here, Busting Breast Cancer statistician, who is the brains behind a lot of these statistics on birth control drugs and other stuff. But so you'll see color charts and graphs, which are much more interesting than black and white, though they look good in black and white too. So if you order from my website, you have to pay $5 for shipping, in addition to the $19.99, but you'll get the colored charts and graphs. And I also sign, if that's of interest, I sign all the ones that I send out. Also, if you have academic courses that you want your teaching courses or a book group, I'm offering like 15% discount on the $20 paperback if you order more than 7 copies, and 20% discount if you order more than 14 copies. So I'm happy to send that out to people. We also have the copies that we'll be taking to conferences with us that don't have their own bookstores at the conference. So yeah, and the more that you can order through the website, that's better for my fundraising of this 40K that I'm now, you know, about to start promoting. Now the book's out, I need to get the word out again. But I'm just so thankful to the Lloyd Symington Foundation, to the Shirley Freeman Environmental Fund, you know, and other foundations that have been, just a few others that have been so supportive of this project over the years.
What about iodine and breast cancer?
You know, that's not something that I really looked at, and I feel badly that I didn't. But I guess nothing is perfect. But I have had an MD friend tell me over the years, and Dr. Brownstein, I believe, who you had on recently, is,
yes,
you know, probably, you know, if not the nation world expert on the whole iodine thing. I think there are people like him that have looked at this, and I would recommend people take a look at theirs. Let me get back, if there are no other questions, let me get back to the metastatic breast cancer situation.
There is one question here.
Okay.
Do you know if DCIS shows as increased heat in a thermogram?
No, it wouldn't, because it's not duplicating. It's not a mindlessly duplicating cell. No, that's why they love you to have mammograms, because apparently the mammogram is the only way they can tell you you've got this stage 0. I mean, I love it. Stage 0 breast cancer. 0 means nothing. It means nada. It means it doesn't exist. It's 0. And they have the audacity to tell tens of thousands of women every year in this country, oh, Daisy May, we're really sorry, you've got stage 0 breast cancer. I mean, that's unconscionable to me. And then the woman's like, oh my God, I've got breast cancer. Oh my God, you know, and at that point, their mind goes blank. They could have metastatic breast cancer. It's just as bad to be told you have stage 0 breast cancer, because all they hear is breast cancer. And they have the women start breast cancer treatment. They even let them stick needles into their breast to sort of see what the tissue looks like, to see what kind of abnormal cells. And there's a wonderful, I really need to plug this. There's a wonderful blog out there called DCIS 411. And Donna Pinto is a woman who is one of those who was, and she'll be the first to describe her whole story to you. A mammogram told her she had stage 0 breast cancer. And she, you know, being responsible, believing in her oncologist, et cetera, followed their prescription of how to treat it. And then she's a very smart woman. She started doing her research, and she was horrified to learn that she really never had breast cancer. And so she started this blog. It's been going on for a number of years now, called DCIS 411. And the horror stories that you hear, I mean, there are some women who are encouraged to have double mastectomies because they've been told they have abnormal cells in their breasts. And of course, we all know the well-known story of Angelina Jolie, and that's a whole nother topic about the BRCA gene, which I will talk about. Women who are born with either a mutated BRCA1 gene or a mutated BRCA2 gene are then told, oh my God, maybe you should have a double mastectomy like Angelina Jolie. And again, if you have the insurance, you know, you're vulnerable. You know, the chances are that you'll go ahead with that, you know, because the reconstruction, that's where the money really is, in the reconstruction. And they want you to have that too. But in fact, all the BRCA1 mutation is that I like to call it, and I talk about this in chapter 8 in the book. We have 3 night watchmen in our breast cells: BRCA1 night watchman, BRCA2 night watchman, and something called P53 night watchman. They are all helping us when our mitochondria start to suffocate. Those guys are supposed to wake up and knock out and then just annihilate the cell, make it self-destruct. And that's what is supposed to happen whenever you have any cell in your body go rogue. Your immune system, in this case, one of these night watchmen, are supposed to come in and get rid of it, and on you go happily. So if a woman has a mutated, that means they've got a faulty BRCA1 night watchman or BRCA2. I don't think women normally have both 1 and 2 mutated. I think it's either one or the other. It just means that you have one less night watchman to help knock out that bad cell. But if you have lost all your excess body fat, if you're keeping your vitamin D3 up there and or you're cleansing your body and detoxifying it and stuff, the chances of your cells suffocating are not that great. So the fact that you don't have one of your 3 night watchmen to help knock out an errant cell is not going to cause breast cancer. And in fact, in this country today, compared to other countries, the statistics are terrifying. In this country, one study showed, this was done between Polish women and North American women, Canadian and US women. It showed that 70% of women who have a BRCA1 damaged gene develop breast cancer before they turn 70, or 73% before they turn 70. In Poland, it's only 49% develop breast cancer if they have a broken BRCA gene. So it says if you have a BRCA mutation and live in Poland, your chances of developing breast cancer are like half as bad as they are if you live in the US. So that right there tells us that it's not the BRCA mutated gene so much as it's the lifestyle of what happens to women in the US. They're following the food pyramid that tells them eat your oatmeal every morning and your bananas, and they're overweight and obese. And it's the government telling them, don't worry about D3. There's no connection between D3 and breast cancer prevention. You know, it's a medical system that is encouraging them, along with Planned Parenthood, to have progestin birth control drugs. Everything is being told to women in this country that is wrong. And you know, in this book, I found after a while, I was using every piece of weird education I've ever had. So all of a sudden I realized, oh my gosh, women, because my PhD is in women's studies. So that means women's psychology, et cetera, that I've studied. And women are much more risk adverse than men. Women are afraid to jump over the mud puddle, and the boys go, sure, let's see if I can do it. The women like, oh no, I'll get my boots dirty. Oh no, I'll probably fall. Oh no, I'll embarrass myself. And for some, you know, and feminist psychology back in the 70s, they figured out exactly why women are so much more afraid of taking risks than men. And I'm not going to bore you, but I think it's interesting with the actual psychology, but it's in chapter 2. And I included stuff by Jean Baker Miller and by Carol Gilligan, and their studies about why women are afraid to question authority. But the reality is, in the US today, women, individual women, form the only group that has the self-interest. And now with this book, the information to actually stop the breast cancer epidemic, one by one, for women to keep breast cancer out of our bodies. And that was my intention of doing this book. I started with myself. I had lost 3 friends like 15 years ago to recurrent metastatic breast cancer. They had each said, oh my God, thank God I had a mammogram. They found it early, et cetera. And they poked them and did biopsies and they radiated them and they gave them chemo. And within years, in one case within decades, they were all diagnosed with a recurrence, but this time it wasn't an early stage. Their recurrence was a stage 4. And each of the 3 of them died an early death before they hit 55. And I got really angry and I said, I don't want this disease. And nobody's telling me how not to get it. And so for whatever reason, I decided to go on this sojourn 12 years ago. And I love to research, and I guess I don't like to work for anybody else. And so I just was willing to do self-imposed poverty and just do what I love to do, which is do research and then writing. And so there we are. But that is about the BRCA gene. There's also a chapter in the book about triple negative breast cancer, chapter 7, and why so many younger women seem to be getting triple negative more than the estrogen positive types. And triple negative in younger women, estrogen positive types in younger women tends to grow much faster. So even though younger women don't get it as much, they still get it more than Polish women of all ages, or women in other countries, of most other countries of all ages. And younger women need to not do mammograms. That's the worst thing you can do, is to radiate premenopausal breast tissue. The worst thing you can do. It will help suffocate that mitochondria so fast. And I'm just basing these statements on statistical studies, and the statistical studies are all in the book. Everything I'm saying, I have backed up with a citation because I have no medical knowledge. I have no biological background. My first and last biology course was a sophomore year in high school. I think I was 1908 at this point, you know, so everything I'm saying in this book is backed up by a peer-reviewed published study of people who allegedly know much more than I do, and put together, we now have the 5 simple steps to help each of us keep breast cancer from coming into developing in our body. Any other questions before? I don't know how long you want to go, but I really want to talk about the, Diane, to everybody found it. I bet that's Diane Weissman, and she's giving us all the foundation for metabolic cancer therapies. She's giving the...
there is a specific question about going on from DCIS, is what is your opinion about intraductal papilloma?
Intraductal papilloma?
Well, that's what the question is, and I can't say I can qualify that question.
No, I wouldn't. I mean, again, all cancer is caused by the suffocation of the mitochondria. Poor Dr. Seifert, I discovered him in 2013, emailed him, and I said, oh my God, I just heard someone really describe your new theory. It makes so much sense. It meshes so much with my statistical studies, which is all I had before his theory was published. And I said, would you have one of your research assistants, review my chapters as I begin to write them? And he said, no, I'll do it, send them on. This is interesting. And I can't tell you, I would find new ideas, new studies, and I'd send him this. I'd go, Dr. Seifert, what do you think about blah, 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 blah? In terms of cancer, increasing it. And he would write back, Susan, it's the suffocation of the mitochondria, Tom. And so I cannot repeat to people enough. All cancer is the same disease. All cancer is caused by the suffocation of the mitochondria. Now, how you suffocate the mitochondria in a prostate cell versus a brain cell, I haven't looked at. I'm assuming it's similar to how you suffocate the mitochondria in a breast cell. My research has been strictly with breast cancer and the statistical studies, the epidemiological studies, as they call them, and some of the laboratory studies, clinical studies about breast cancer. So quickly, let me do the recurrent metastatic breast cancer, because I really need help with this one. Oh, I should say that chapter 10 in the book has 7 action steps, and I have pulled each of these action steps out of all of the other chapters in the book, and they're either an administrative change that we want the FDA to make. It's a clinical study we want the National Cancer Institute to fund, or it's an educational study we would like any agency that wants to, HEW, whatever, to fund. Everything from teaching women, again, how to do breast self-exams, and encouraging them to have clinical breast exams instead of running to have a mammogram, to funding, as I mentioned before, clinical studies, double-blind, on using just metabolic therapies for metastatic breast cancer is what I'm hoping for. But right now, every physician, Dana-Farber, all other cancer centers, they're required, when a woman goes to them and they diagnose her with recurrent metastatic breast cancer, that clinic, that doctor is mandated by the state medical licensing board to fill out this huge document. And I quote, I give a citation for the page, the verse, and everything of what they have to say. They have to say that Jane, I'm assuming it's anonymous, but that Jane X, age Y, has just been diagnosed with recurrent metastatic breast cancer, and it is in her bones and or her brain and or her liver, etc. That's the kind of specifics that every doctor has to report for every woman who is diagnosed with recurrent metastatic breast cancer, and every man for recurrent metastatic prostate cancer, whatever. They have to report this to their state cancer board. The state cancer boards, if they want to maintain their almost 100% of federal funding from either the National Cancer Institute or the Centers for Disease Control, has to send that data in every year to their federal funding agency, and different agencies fund different states. And then those two, the CDC and the NCI, have to send all of their state data. And now we have the national data, but they don't send it to a government agency. They send it to a private organization that is controlled by the National Cancer Institute, the CDC, the American Cancer Society, and the Commission on Cancer, which is the American, it's the medical and the chemical industries. And those are the groups, and it's a small group of statisticians that sits in Springfield, Illinois. They are the only organization that releases our national cancer data. And guess what? They are not releasing the number of women every year who are being diagnosed with recurrent metastatic breast cancer. They are telling women we don't have those numbers. And my book, I think, is the first one that is telling me and everybody else, oh yes, we have those numbers. But those numbers are maybe going up. And that becomes very, very embarrassing for the cancer treatment industry. And I have found any number of clinical studies by oncologists who are working with women with recurrent metastatic breast cancer. And they, as a matter of fact, without even citing their citations, say 30%, 40%, 20% of all women who were treated for early stage breast cancer return to us with recurrent metastatic breast cancer. And if those numbers are correct, and if the numbers are increasing, as I believe they are, now I haven't had a television in literally 50 years. And I'm glad I haven't, because I haven't been brainwashed by the American TV culture about pink ribbons and mammograms, whatever. But my understanding is that most advertisements these days are all about metastatic breast cancer drugs. And that is because if you look at the reports, the marketing reports, almost, if not more than 50% of all breast cancer drug income today is from metastatic breast cancer drugs. So it is critical that women demand that their state cancer boards, start with the state boards, that they release their recurrent metastatic breast cancer data from the last 5 years, 10 years. Let's see what those numbers are state by state. And then we can push the National Cancer Institute to release theirs. And I don't know if we'll ever get that private group called the North American Association of Central Cancer Registries. And I talk about them in the book. They've been very nice to me and given me some really important up-to-date data that they have, not on metastatic breast cancer. That's not being released, but on everything else. So that's decent. But that's how I maybe need to end. I don't know.
Thank you. Fascinating presentation.
Thank you. I'm happy to take questions if there are, and if not, and we've been going for, a good hour and a half. People must be tired. Thank you, Susan. Thank you, Bill. Yeah, so Amazon, Barnes & Noble, bustingbreastcancer.com. And if you have any foundations out there that you think are interested, or individual contributors, it can be tax deductible. Just write to me, Susan, email me, Susan@bustingbreastcancer.com, and I'll guide you if it's going to be tax deductible, how to do that. And if not, then you can just send it to Busting Breast Cancer, and the address is on the website.
Susan Downs, any last minute comments? Okay.
I do see some questions on here. Does exercise make any difference? And before she answers that, I'd like to say next week we have Andrew Saul, who's done lots of research, and he's a director of some orthomolecular group. And I think that's March 1. So put it on your calendars. But last question seems to be—
He's one of the best in vitamin C information. He's top level.
So exercise, yeah, I mean, anything to keep the lymph system moving in your breasts. So that I do dry skin brushing. So before you take a shower every morning, whenever you take a little, just gentle bristles, and you basically go up toward your stomach, down toward your stomach. And I describe this in chapter 6 in the book, because that just tickles the skin, gets the lymph system going. Our blood supply is pumped by our heart, right? But our lymph system, which especially with women who are large breasted, you know, and if they keep their breasts in bras a lot of the time, you know, there's a stagnation that happens, and that can cause the suffocation of the mitochondria in the breast cells. So any kind of stimulation of the lymph, and this is why, you know, no sweat exercise is critically important. Just walking the dog around the block is important. And to also work up a high sweat. And you can do that if you're unable to, you know, bike or run or whatever will bring up a hot sweat. Wonderful, wonderful infrared saunas. You can just sit there. It's delightful, but make sure you sit there until you're really sweating up a storm. Don't get out as you start to get hot, because the idea is to sweat out the toxins and cleanse, you know, your body. So there you go. Oh, here, Michael Gonzalez. Michael is a darling, wonderful supporter. He's a professor at University of Puerto Rico, and he wanted to say thank you, but he doesn't know how to unmute himself. So there we go. Thank you, Michael, and I'm glad you're listening in.
Any other questions? This is your chance. Get the answers from the expert.
Oh, I don't know about that. Filled with data is what I am. Filled with data. Yeah.
Yeah. Susan, I got unmuted. I would like to congratulate you on such a great contribution. I know Tom. It's proud of you. Me too. And you know that we came to the same conclusions. Tom could be my mentor, but you know I published the bioenergetic theory of carcinogenesis, which is the same idea, Tom, but we came from different angles. So we have done some studies that validate what already Tom has proven. So we came up with an article that I recommend to everybody, which is called Mitochondrial Correction. You could Google it up. There is Tom. Tom is a co-author, Garth Nicholson, me, Dominique D'Agostino. So you have a dream team there. I put together this dream team. And it's an article, it's a review article on how to improve mitochondrial function that kind of validates all the ideas that you present in your valuable book. Thank you for your contribution, and a big hug from Puerto Rico.
Thank you.
Would you like to speak at the Silicon Valley Health Institute, Dr. Gonzalez?
Yeah, sure. I'll write my email here on the chat so you can communicate directly with me.
Good idea. I'd also like to suggest that if you've got a fence and when you're doing your natural sunning at noon to develop a tan, that you consider going topless but the fence is absolutely necessary to make sure you don't get arrested.
That sounds interesting.
Yeah, but infrared radiation from the sun does improve microcirculation. So that's one other way to improve the blood flow and oxygenation of breast cells and fat cells.
Steve, if you're a company that with grounding, it's perfect.
Yes. Yeah, so wet down your concrete before you step out onto your patio. Yeah, put some Epsom salt on your patio too. Okay. Thank you all.
Thank you. You guys have a nice afternoon.
Thank you. I appreciate being able to present. Thank you.